Hey everybody, Dr. Megan McCarthy here again from the Reno Orthopedic Center.
And I'm Dr. Dan Curtis. We are going to talk about another fact or fiction topic. So, do you want to start us off?
Yeah, so biologics, right? PRP stem cells, right? Stem cells, like that's gonna cure everything. Maybe someday, but I think for this we also have to proceed with caution. I sound like a very cautious human being, and maybe so, but I think that especially for these biologics, which are extremely expensive, this is kind of where you got to be aware of the snake oil salesman.
Yeah, totally. And I mean, we have patients all the time that ask about stem cells, ask about PRP. I mean, I think a little knowledge to start is helpful. So can you tell us, like, what are those things? Are they the same
Totally.
as PRP, a stem cell?
So I'll start with PRP, so platelet-rich plasma. So to get PRP, you draw your blood, or somebody draws your blood, spin it down in a centrifuge, and you collect the top layer. That's the platelets, the platelet-rich plasma. And platelets attract growth factors. And so, you know, if you tear your rotator cuff, you want a bunch of growth factors there. It's sending signals, hey, come help heal this tissue. And so that's what happens in the body. Now, if you inject PRP, will you get that same response? Maybe. And PRP injections start at around $700 to $800 a shot. And so in my knowledge of the literature, which we try to be as scientific based as we can, the only study that shows some encouraging effects of PRP is with lateral epicondylitis or tennis elbow. And so that's technically injecting into the common extensor tendon, which originates on the outside of your elbow, and healing that tendon, which should then help with pain, inflammation, function. But they're expensive, right? And they're not covered by the FDA. They're not covered by insurance because they're not approved by the FDA. And so I think that's like a big red flag, right? That's PRP. Stem cells.
Yeah, stem cells. So, in PRP, there aren't really stem cells, right? And so it's sort of a different category. Stem cells sound so great because you basically just inject them, they become whatever you need them to be, and boom, you've got a perfect tendon or perfect joint again. Unfortunately, it doesn't work that way. So, the laws in the U.S. governing stem cells essentially state that we can't manipulate stuff that we take out of the body very much and then put it back in. So that's a minimal manipulation rule that the government says. So basically, we have to use the tissue that we harvest and kind of put it right back in. So PRP basically, it satisfies that rule. But most stem cell therapies are, they're not very effective because they can't be manipulated very much. So there's actually very little literature that stem cells, when you re-inject them, that they're actually living when they re-enter the body. And there's extremely, minimal evidence that they become anything that we want them to be, because how would they know what to become? They're just cells. So I think that stem cells, you really got to be careful with when people are selling you those, because those are big money.
Yeah.
Those cost thousands of dollars, and it's probably not realistic that it's going to truly help you. So I counsel patients all the time, don't do that. PRP is something we offer here because it does have some application clinically. Stem cells, we don't, because we really just don't believe that it's really beneficial. So and
I think you especially have to be careful of where these like stem cells are coming from, and are they even stem cells? Like these like placenta, whatever. Those are dead cells. Dead cells don't become anything, and I love podcasts. There was one, the Dr. Death one, that's whatever.
Yeah.
But there was one about stem cells, and this person was injecting them down in Texas and gave people like horrible infections in their spine, and so.
And I've seen it. I mean, I've seen patients with stem cell injections in their knee, and they get
infections.
septic arthritis.
So I feel like, for sure, like Dr. Curtis said, stem cells, definitely fiction. PRP,
I think, is a mix.
I totally agree.
Because I think you're right. For tennis elbow,
Yep.
lateral epicondylitis,
Yep.
it can be helpful. There's some evidence for like mild arthritis that it can essentially work almost like a longer acting cortisone injection. Doesn't regenerate the joint,
Right.
So I think it's a little mixed on this one.
And I think a little fun fact, on the airplane when you see those advertisements for stem cells, you know, and they have a picture of a knee where it's totally bone on bone, and then they say after the injection, and you see this knee and it's like wide open joint space. Usually the first one where it's bone on bone, the patient's standing, and then the second one they're laying down, so they're not loading their joint. It's such a good trick.
It's a good trick. We should do that maybe.
Yeah, good results. So.